Do you have hand arthritis or is it an old injury? Let's discuss and show you some ways in which you can fix this. My name is Huang. I'm an occupational therapist and certified hand therapist, owner of Hands-On Therapy Services located in Miami. If you have hand and arm injuries, let me know how I can help you. I've been getting a few patients that come in with various types of hand injuries that tell me, I think I have arthritis, or my doctors told me I have arthritis. So I want to help you understand what that means, because that's not a death sentence. Arthritis doesn't mean pain. It actually doesn't. Arthritis literally just means your bone has changed in the way it's supposed to move. And there's various types of arthritis, and knowing what type of arthritis you have can be really helpful to just knowing how and what's possible to fix it. Arthritis that comes with age, right? So if you are in your 60s, 70s, or 80s, you can develop arthritis, arthritic changes in your joints that cause it to look big. So usually these nodules that grow on the sides of your fingers, right? That's a type of arthritis. That's a type of osteoarthritis that then just you have extra bone growth, right? For some people, they have these nodules. They're called Huberden nodules and Burchard's nodules, just to be real specific. But we have these nodules on our knuckles, and it's usually a sign of like, hey, you have like extra bone growth. Can therapy do anything about it? Not really. We can't change how that bone looks. All therapy does is helps you to move better so that you don't start to lose your motion. So what happens is when those kind of extra growth can happen, one, you can have pain. Two, it's just an appearance thing and you don't have any loss of pain. You don't have any pain. You don't have any loss of motion. If you have pain, if you have loss of motion, one of the things that helps with pain is heat. Moist heat helps the best. Moist heat is like hot water, getting in the jacuzzi. Paraffin baths can be really helpful. Getting a warm, like a heated wet towel. You just have to be careful not to burn yourself if you're throwing that in the microwave, and then just wrapping your hands around it. Like the moist heat can help to like just loosen things up. And once you loosen up, you can do like just a little massage, right? The key thing isn't just to massage like up and down, it's to massage on the sides, because that's where your ligaments are and they get really, really tight and irritated. So you can do a little massage. The only problem with that is that when you have arthritis like that from those nodules, it tends to affect both hands and it tends to affect multiple fingers. And so my recommendation is like, go somewhere and get yourself treated. Go somewhere, go to a hand therapist, go somewhere where they'll like know how to like move your joints. The best time to do is like when it's at the beginning stages so that they don't get stuck. Because when you get pain, you tend to be like, oh my God, maybe I shouldn't move it. And then you don't move it and that's when it gets stuck. But technically speaking, you're allowed to move it. You just want to know how to move it. So one of the things outside the massage is you want to stretch it straight. I know everyone's like, oh, I don't want to lose my bending. Here is the magic trick that most people aren't telling you. It's like when you stretch it so that it goes straight, you'll actually be able to bend it better. And I know I tell my patients this all the time and they're like, that doesn't make sense, Juan. That's because the muscles that pull your finger down, they're really, really big, strong muscles. We have one tendon that comes here and one tendon that comes here, and we have all of them in our fingers. So you have a total of 8 tendons. They start from down here, they cross your wrist, and they come up and they help you to move your fingers. So those muscles are really, really strong. But the muscles to open your fingers, we have 4 of them that come to these knuckles, but then they become little itty bitty strands of tendons over here. They're not that strong. So what happens is to bend it is actually easier than to straighten it. So you need to help your hands straighten up. So one of the things that you can do is you can go one at a time. Key thing is this knuckle and this knuckle. Once they become problematic, and you'll get hand pain and it'll feel like you even have more arthritis than you might have. Don't get tricked and fall for the x-rays look like this. X-rays show bone and they always show, it's like showing you naked, right? You see everything regardless of whether you wanted to see it or not. But that doesn't mean that other stuff isn't contributing to it, right? So don't let that play with you mentally. You can have arthritis and not be in pain, right? It's totally possible. I've worked with people, it happens. So one of the things that we do is we like to make sure that this knuckle goes straight and this knuckle goes straight. If you can get these two knuckles to go straight, it's gonna reduce the deformity, like how bent your hand looks, but it will also help to reduce the pain. So when you stretch the middle knuckle and the little knuckle straight, guess what? It stretches those tendons I was telling you about, and it makes those tendons longer. So by making them longer, they're going to be able to move better. So one, you have to stretch this knuckle straight and this knuckle straight. And so you can go one at a time, right? You see how I'm using my thumb? So it's not that hard, one at a time. The other thing is you can use a table. So you can put your hand flat. Let me see if I can show you. You can put your hand flat and then you can press it, right? So instead of like that, just press it down like this. Use all your palms so it doesn't hurt your other hand, right? So, and you can massage it from the top, you can massage it from the sides, right? You can massage it up. You see how your skin is supposed to wrinkle? See how your skin is supposed to wrinkle? Yeah, you're supposed to be able to pull it up. When you have wrinkles on the back of your hand, that means you're able to move well. Because in order to make a fist, all that skin has to stretch over those bones, right? So think about one, massaging, two, stretching these straight, right? And then once you have it straight, then you are able to bend it like this, right? And if you bend it where you take your hand, you hold your big knuckle straight, and you curl just the little knuckles, right? The middle knuckle and the little knuckle. You're going to be a lot more deliberate with moving your fingers so you don't have that arthritic feeling pain. That's if you have like true arthritis. You're seeing the nodules. Therapy is not going to help you with the nodules. I guess they can go in and shave it if you really from an aesthetic standpoint, but then you need a ton of therapy because you're messing around with like those tendons back there, and it creates a lot of scars. So you really have to think about what you need and when you need it. Everyone's going to be on a different path, different severity, so depends on what's going on with you. Take this as just educational. If you're finding me at the beginning of your journey, try those things out. Really recommend finding someone to help you do that because they can be more specific with your needs versus me. I'm just teaching in general. So that's really important. Now that's true arthritis. It comes with age. So when people are coming to me and they're like in their 30s, 40s, and 50s, and they're like their hands look normal, right? But maybe this one injury, they have a big knuckle. Maybe it's one injury, it's bent. And that arthritis is coming from an injury. And so you're getting what we call a post-traumatic arthritic joint, meaning you had an injury, and because you didn't move it fully the way it's supposed to move and the capacity that it has to move in, then you're starting to get your muscles and your ligaments that pulling that joint together, pulling, and it's so tight that the bone is just rubbing on itself. And so every time you bend, you're just rubbing. Joints need a little space. It needs a little space, right? It's just like your armpit. You need to like lift it up, right? You need a little space. You need space between your fingertips. Between your fingers, right? So think about all the places we need a little bit of space so that we can move better. When you have an injury and you don't fix it to its full capacity, everyone's injury has a full capacity it can get to, right? Majority of the time people stop when they're about 50-75%, and they kind of slide backwards a little bit. I know because my husband did this. I see it in my patients all the time. So when you try to get to that 100%, like get to where it possibly can go, you can actually reduce your risk of post-traumatic injury. I had a patient come into me. She broke this finger, poor thing. She was getting engaged and she broke her wedding finger, and she was trying to get it better so when she transferred her engagement ring to when she got married, that her finger wouldn't look all deformed and big, right? So when you have a fracture and it's broken inside the joint, fractures or old injuries like that can make it harder to get full capacity, but it's totally possible. So one of the things that we worked on a lot was just to get that knuckle as straight as possible. So look at my knuckle, right? See how much what I would call, this is what we call extension. My knuckle, I'm very hypermobile, so my knuckle goes beyond 0. So whatever your body type is, it wants to go back to its original state, right? So if your knuckle only goes to straight, you can use it and compare it to your, if it goes only straight, then this hand that got injured only goes straight. But I always say, if I broke my finger, knock on wood that I don't, right? If I ever broke my finger, whoever is working with me, my therapist, and I teach therapists. So if you're a therapist and you're watching this, go to Hand Therapy Secrets. So that's my platform where I teach therapists. If I ever get injured, knock on wood, and I go to a therapist, I want my therapist to get me what is called an end range of motion. I have got to get to the very end of my motion in order to feel really good, in order to not have pain, in order to reduce the risk of what is called post-traumatic arthritis. I have injured my knees too many times to count, and one of the things that I worked on when I injured them and as a practice is that I want to maintain and keep my end range of motion. I should be able to bend it without feeling it. I should be able to extend it without feeling it. And then I just have to work on my muscles to make sure my muscle has the capacity to move and it's in the way it's supposed to move. Now, some injuries are like so bad that you never get it completely straight. That's okay. You get it to as straight as your new normal is supposed to be. So if this is your new normal, you're like, usually as a therapist, I can feel it. I can feel this is your new normal, and that's what we want to get it to, and that's where we want to get it to and then keep it there. So let me know if that helps you understand. Like, I know a lot of people come to YouTube because they want videos to like show them exactly what to do. But my patients always do really well when they understand first what's required, because then they'll be more motivated to actually do the thing that they need to do. So the stretches that I showed at the beginning, where I was showing you how to massage not just on the top, but on the sides of the fingers, and then how to stretch, is how you can do it for an injured finger as well. If your finger is injured though, you might have to learn how to really get into the detail of what's wrong with it so that you can stretch it better. I have a kid who is 17. His parents are bringing him here because he injured his finger playing football. And so many people have that type of injury. And in the young people, you have the capacity to fix it when it's still relatively new, even a year or two later, right? But once I've seen it and my patient's like, well, I injured this like 20 years ago, dude, we not fixing that. I'm like, I probably can't. It's probably fused, stuck like this, and you probably can't really do anything. So fix it while you can so that you don't end up with like hand deformities and arthritis in your fingers. Arthritis in your fingers over time can affect your level of independence. All right, let me know if that helps. Again, my name is Huang, owner of Hands-On Therapy Services here in Miami. And if you need my help, my link is below, and reach out to my team. My team will help you.